We are on the session on biodiversity, pollution, and habitat loss. This is also one of the themes for WIOGEN, and here the focus is to see how ocean governance can bring in strategies to conserve biodiversity, to reduce habitat loss, as well as reduce pollution. So we are going to have 3 presenters in this session. Each presenter is going to have 10 minutes to present, and 5 minutes we'll use it for question and answer. And after every presenter, we'll have question and answer session. So that's how we'll go. So I would like to introduce the first speaker. Is Jean in?
Yes, hello, Juliet, I'm here. Can you hear me?
Good. Yes.
Good.
So welcome, Jean. Jean is going to talk about using One Health for sustainable mangrove management in Kenya in the context of towards co-producing knowledge in a multidisciplinary network. So I'm going to let you continue, Jean.
Okay, I have to try how I can share my screen here most easily. So, one moment. Okay, can you all see my screen?
Yes, we can.
Okay, good. Let me see. Okay, so I'm going to speak about One Health for sustainable mangrove management in Kenya and about co-producing policy-relevant knowledge. At least that's what we hope to do. So I'm presenting on my own today, but of course it was a group endeavor. So for this presentation, I collaborated with my colleagues Maarten van Hove, Cosmas Munga, and Farid Dardougebas. But for the whole project, we have a collaboration with Kemfree and with the Technical University of Mombasa, and also with 3 Belgian universities. Myself, I work at the Open University of the Netherlands and at the University of Hasselt and at VUB in Belgium. Okay. So first I'm going to speak about what One Health is and why it could matter, especially for Kenyan mangroves, but also beyond only Kenya. And I will discuss some preliminary results from an expert survey that we've done last May. And I will discuss some next steps, which will hopefully also open the floor for some comments and questions. So first of all, One Health. So the concept of One Health is not known by everyone by name, I would say, but I think the principles and the main ideas of One Health will be familiar to most of us here at WIOGEN. So One Health is basically a concept that tries to unite environmental health, so healthy ecosystems, with human health and also animal health. And in the middle, you could say that, well, this is One Health coming up there. So yes, it's kind of a buzzword, but it's also an interesting concept. And it can be operationalized in, for example, indicators and in very tangible, very concrete actions. At least that's what we hope. So another way of presenting it is in this figure, which was drawn by the Convention on Biological Diversity, the CBD. So you can see that there are both risks and benefits when human and nature interact very closely. So this interface between well, human health and animal health and environmental health sometimes is very positive. For example, a healthy environment may mean that people are more healthy, mentally healthy, but also physically healthy. But it can also mean that there's a stronger risk of zoonosis, of disease that can be transmitted from animals, for example, to human beings and vice versa. So there's both risks and benefits there. I cited the CBD, the Convention on Biological Diversity, but also UNEP and many other organizations have talked about One Health, and also the World Health Organization now uses this concept quite often. You could also say it combines different SDGs, so the Good Health SDG, which is SDG 3, but also the biodiversity related SDGs, which most of us probably know. So here's a very quick example of what One Health can mean in theory. It's also a shameless self-promotion for our team, because Maarten van Hove and myself are also co-authors here. But just to give you a quick idea, you have 2 axes here. So the x-axis is about the mobility. Are we speaking about the global or the local level? No, sorry, that's the y-axis. And the x-axis is about connectedness with nature. And basically, this was a paper in which we said that, yes, indeed, COVID-19 originated at the interface between humans and nature. So it could be a risk, which is, coming from this link between humans and nature. But the solutions to such diseases and new diseases also come from a novel reconnection with nature, where we have, as humans, a more sustainable and a more moderated link to nature. So I will not go into detail here, but you can find the paper online if you want to. So let's go back to what we are for here. So what I wanted to ask is, like, why does One Health matter for mangrove management? So when people think of mangroves, people think of all the ecosystem services, all the benefits that can be provided by mangroves. There's been lots of research on that. For example, when it comes to storm protection, but also carbon storage, mangroves play a key role in the blue carbon debate. And you can see here in that figure by UNEP that, well, mangroves also provide timber and forest products. They are nurseries for fish. They play a role in climate regulation and shoreline stabilization, etc. So they have many benefits. But what we wanted to try now is to see, well, maybe there are also health benefits that are a little bit being undervalued or a little bit neglected so far. So that's what we want to see. Can we broaden the scope of these benefits provided by mangrove by bringing in a health angle? And maybe there are also risks associated with mangroves. Maybe it's not only benefits, maybe there are also risks there. Because indeed, next to the benefits to people, like ecosystem services, etc., mangroves are sometimes perceived negatively, or at least were sometimes perceived negatively. Luckily, nowadays, most of the perceptions of mangroves are positive, but it could be negative sometimes. And this is from a paper by Dan Fries from a few years ago. And you can see that in the late 1800s, so in the late 19th century, mangroves were often associated with danger, disease, and with a gloomy kind of mood. So people were not so positive about mangroves as we are now. So mangrove perceptions actually matter. So the way people see mangroves will matter for their conservation. So if mangroves are only seen as a carbon sink, well, you could say that's good because then mangroves will be concerned. Yes, indeed, but mangroves are much more than that. They're also a safe haven for biodiversity, and they also provide many benefits to local people and even to people much farther away from mangroves due to their role in regulatory ecosystem services. So we now zoom in on Kenyan mangroves. So I guess most of you are familiar with the Western Indian Ocean African coastline, but here on the map at the left side, you can see where Kenya's mangroves are located. So there's a huge concentration of mangroves around Lamu, and then there's quite some mangroves around Mombasa and south of Mombasa, where Gazi Bay is located. And the picture above is from Gazi Bay, where many of our Kenyan colleagues work. And below, you can see a picture of Tudor Creek with Mombasa in the distance, where there's also mangroves there in a much more peri-urban setting, in a much less natural setting, you could say, than, for example, in Gazi Bay or around much of Lamu. But you can see that Kenyan mangroves show a whole continuum of degradation. Some are very degraded, some are very well protected, some are heavily used, and other mangroves are much less used. So the Kenyan coast is an interesting case study also to check the One Health approach over there. And Kenya also has a lot of very skilled scientists working on mangroves. So for us, it was also interesting to see, okay, what does that mean? Can One Health actually be an added value there? So we did an expert survey on the relevance of One Health for mangrove management in Kenya, which is a collaboration among multiple institutes. The first step we conducted in May this year, so it was an expert survey. The second step, which we plan to do, is to broaden the scope of stakeholders' input by including other non-scientifically trained stakeholders. And then we also want to work towards One Health indicators for mangrove, maybe to see if these indicators could actually steer and guide mangrove management in the future. So some preliminary findings, because we're still processing the results, and the paper is not there yet. So one of the, I would say, surprises of our survey was that 70% of the respondents had never heard of the term One Health. So you could say, okay, so it means it's not relevant, maybe. Well, it turned out, yes, it was, because once a definition was given, all respondents, remember all these people were scientifically trained people, all respondents did connect One Health IDs with their own work and with mangrove management in general. So the term may not be very well known, but the whole ID was very well known and was considered quite relevant. So some of the responses on why One Health could be relevant for mangrove management, that was an open question, were that unhealthy forests can lead to, well, less nutrition and to bad health. Links were seen with ecosystem-based management and integrated coastal zone management. There was also links with COVID-19, because people lost their formal jobs, at least temporarily, due to COVID-19, for example, in tourism. And mangroves got degraded. And some scientists believe that, well, due to the decline of the regular economy, many people went back to a more destructive use of mangroves, which they hadn't done for years. That was at least one of the hypotheses there. So there was also the relevance of One Health to study novel pests in mangroves, so infestation of insects, for example, and what that can mean for ecosystem health, but also for human health. And peri-urban mangroves were seen as especially relevant interfaces where people, ecosystems, and pollutants can actually closely interact. Antibiotic properties of mangroves were mentioned, as were mosquito-borne diseases. So that could be seen as a kind of disservice of mangroves. So then our next questions were about the taxa to operationalize One Health. So taxa, think of like species, for example, or groups of species, or families, for example. And so when it comes to operationalizing One Health for mangrove management, mangrove trees themselves were very often cited as good indicators, for example, or potential indicators. Because if we know much more on mangrove trees, I mean, how they're doing, how their area is, well, declining or increasing, we can directly link that to human well-being, because people use mangrove trees directly, but also indirectly, because the presence of mangrove trees can tell us a lot about fish nursery, for example. Then other taxa that were mentioned include crabs, but also mollusks and fish. And there you have to think of, well, if crabs and fish and mollusks are polluted, and if people eat them, well, of course, then you can have an effect on health. So you can say it's healthy to eat lots of seafood. Yes, it is. Well, on the other hand, when there is like pollutants being eaten by the mollusks and the fish, it could also end up in humans. So there's a clear health link over there. Birds was also seen as one of the taxa to operationalize One Health, because birds can tell a lot about how healthy ecosystems are. So the choice of these taxa to operationalize One Health, this choice was informed by knowledge generation potential. How much can we learn from these taxa? But also by the feasibility. Do we have data on this? Do we have experts, for example, in Kenya, who work on these different taxa? We also asked people about health-related ecosystem services linked to these taxa, and health-related ecosystem disservices linked to these taxa. And food provision, air purification, and the multiple indirect health benefits were often cited when it comes to ecosystem services. And when it comes to disservices, so the negative or potentially negative aspects, mosquitoes were mentioned, but also the probable or possible occurrence of disease-carrying organisms in mangrove-dwelling organisms. For example, think again of fish and crabs, etc. Sulfur dioxide emissions and the bad smell, sometimes in mangroves, was also mentioned. So we also asked about the communication potential of all these taxa. So yes, we can learn a lot from these taxa, but how do we communicate the value of mangroves from a One Health perspective to various stakeholders? Then we got quite some interesting responses there. Just give you a very quick illustration. So one respondent said, you cannot recruit money to study crabs, but you can get millions of dollars from mangroves. So mangroves are seen as important themselves, but when we think of operationalizing indicator taxa, we should also think of the iconicity of all these species or these taxa. And then another respondent said that tourists want to look at crabs in a plate. They want to eat them. And policymakers look at the extractables. What can they get out of mangroves? So we need to take these very practical aspects also into consideration when selecting indicator taxa, for example. And then health-related indicators, for example, linked to food safety, generate a lot of attention, and many respondents also saw some possibilities there. So we also specifically asked people if they had ever heard of zoonoses in mangroves. Zoonoses are a disease that can jump from animal host to human host and the other way around. Well, no respondents raised mangrove-associated zoonoses, but mosquito-borne diseases were mentioned, like dengue, and also bilharzia. There was no knowledge of possible hypothetical occurrence of food-borne trematode infections, like paragonimiasis in Kenya. probably because raw mollusks and crabs are typically not being eaten in Kenya. But it is a problem in some Asian countries. Okay, so these were the quick preliminary findings, just to give you a few ideas. Now, to think of the next steps, what we want to do is to gather additional input from other stakeholders, a more diverse set of stakeholders. We also want to operationalize One Health further by proposing very tangible indicators. And we want to open up the debate on the relevance of One Health for mangrove management beyond Kenya. For example, also in countries with a smaller mangrove knowledge base, which is a smaller mangrove coastal science and management community than Kenya. So One Health can be an additional perspective to enrich and improve mangrove management, and maybe also to strengthen communication about the key role of mangroves for human well-being. What One Health can also do is operationalize the shared risk perspective, meaning that if we destroy the environment, for example, we as humans are also at risk of some novel diseases, for example. And healthy ecosystems and healthy human beings often go very well together. Okay, that's my presentation. I hope I stayed within the time. If there's some questions, I'd be happy to respond. Thank you very much.
Thank you so much, Jean, for that presentation. It's a very interesting topic and brings in new ideas on how to holistically look at ecosystems and manage them in that way. So thank you so much. I'm going to open up the space for anybody who has questions or comments for Jean. You can raise your hand and ask. And as we wait for someone, I have a couple of questions to you, Jean. So one thing is about the indicators. This is a very broad way of looking at an ecosystem and managing it. So how do you bring in all those indicators and what is enough? Because if you look at the human aspect, the environment, the ecosystem, how much do you bring into that one pool of indicators?
Yeah, and thank you. That's a good question. And I must admit, we're struggling a bit with that, as are our respondents. So our aim is not to replace existing indicators which work really well to inform mangrove management. That's not our aim. So we are very well aware that many indicators are already there and are working quite well. We're just thinking of maybe can we add some extra indicators which give a little bit more information on that One Health layer of mangroves. And for example, we could think of, for example, the density of certain species of crabs or certain species of fish, etc., and especially focus on edible species, species that are being caught and eaten by people, or by mangrove fringing communities, or even by the tourists around the coastal resorts in Kenya, etc., and see if we can say something there about the potential risks or the potential benefits that people can get when eating particular species of fish, for example. So that could be one of the indicators that are there. Others could be like the presence of pathogens, or some pathogens especially present in mangroves. Maybe some pathogens are more present in degraded mangroves near urban areas than in pristine mangroves. Some pollutants may also have direct health effects on animals and humans. So if we can link the concentration of some pollutants to health, that would already be interesting, I think, for One Health indicators.
Thank you so much, Jean.